Best homeopathic medicines for recurrent habitual abortion, threatened abortion. What is abortion? Abortion refers to the expulsion of the fetus from the uterus before the 20th week of gestation. When abortion occurs spontaneously, it is referred to as spontaneous abortion or miscarriage. Vaginal bleeding occurring during the first 20 weeks of pregnancy is referred to as threatened abortion. Bleeding varies from light spotting to heavy bleeding. This may or may not be attended with abdominal pain. Recurrent or habitual abortion refers to 3 or more spontaneous abortions occurring one after the other without any intervening pregnancy. Risk factors for recurrent habitual abortion, threatened abortion. The risk factors that predispose a woman to threatened abortion are age above 35 years, abdominal trauma, bacterial/viral infection during pregnancy, chromosomal abnormalities, multiple pregnancies, pregnancy with more than one fetus, growth in uterus like fibroids, problems with the placenta, smoking. The various factors that predispose one to repeated abortion are malformation of uterus, cervical incompetence, hormone disorders including hypothyroidism, PCOS, diabetes mellitus, chromosomal disorders, endometritis, infections such as toxoplasmosis, rubella, herpes simplex, cytomegalovirus, Coxsackie virus, and measles. In addition, lifestyle factors such as smoking, alcohol and drug intake also put women at a high risk of repeated abortion. Homeopathy can treat tendency towards recurrent/habitual abortion. Threatened abortion. 1. Homeopathy is a highly advanced science known to effectively treat many gynecological and obstetric conditions. Homeopathy remains very successful in treating the tendency towards recurrent abortion and threatened abortion. Homeopathic medicines to treat these conditions are prescribed based on the individual symptom presentation. Each case and its symptoms are studied in detail before a prescription is decided. The month during which miscarriage occurred previously, the character of the bleeding, accompanying pains, menstrual history are noted down. In the case of threatened abortion, a gynecologist should be consulted while homeopathic medicines play a supportive role. Homeopathic medicines to treat recurrent and threatened abortion should always be taken only after consulting a qualified homeopathic physician. Self-medication should be avoided at all costs. Homeopathic medicines for tendency towards recurrent/habitual abortion, threatened abortion. Cauliflower thalastroides and Holonius dioica. Effective homeopathic medicines for the tendency towards recurrent/habitual abortion from uterine weakness. Cauliflower thalastroides and Holonius dioica are top-grade homeopathic medicines for treating tendency towards repeated habitual abortion from uterine weakness. Cauliflower thalastroides and Holonius dioica are top-grade homeopathic medicines for treating tendency towards repeated habitual abortion from uterine weakness. Cauliflower thalastroides will work best where there is a tendency towards habitual abortion from uterine weakness and uterine atony. History of leukorrhea of acrid nature may also be present. Holonius dioica will best treat habitual abortion where the uterus is weak, with a feeling of weight and soreness in the womb. During the abortion, bleeding of dark, foul blood is present. Dragging in the pelvis may be observed. Other attending features include exhaustion, profound sadness, and irritability. Viburnum opulus. Top-rated among homeopathic medicines for the tendency towards recurrent/habitual abortion in early months, 1st to the 3rd month. Viburnum opulus is one of the very significant homeopathic medicines for the tendency towards recurrent habitual abortion in the early months, i.e. between the first 3 months. Cramping pain in the uterus, which extends down the thighs, is observed. Women who need Viburnum opulus may also have a history of late and scanty menses. The menses last for a few hours only. Offensiveness in menses is noted. History of leukorrhea of thick, white nature, often blood-streaked, may also be present. Sabina officinalis and Cicale cor. Best homeopathic medicines for the tendency towards recurrent/habitual abortion in the 3rd month. Sabina officinalis and Cicale cornutum are significant homeopathic medicines for the tendency towards recurrent habitual abortion occurring in the 3rd month. Miscarriage is accompanied by bright blood mixed with clots. Along with this, pain from sacrum to pubis during bleeding is present. Women who need Cicale cornutum have a history of recurrent miscarriage with dark or blackish bleeding. There may also be a history of brownish, offensive leukorrhea. Women prescribed Cicale cornutum have thin, cachectic and feeble constitutions. Apis mellifica. One of the top-grade homeopathic medicines for the tendency towards recurrent habitual abortion in the 4th month. Apis mellifica is the most suitable among homeopathic medicines for the tendency towards recurrent habitual abortion in the 4th month. Bleeding during the abortion in the 4th month, with soreness and tenderness in the womb, is a sign Apis mellifica will aid recovery. This medicine is also useful where there is a history of ovarian cyst with stinging pains. A case history will reveal short and scanty periods. Acrid, green leukorrhea at some point in the past may also be observed. Kali Carb. Homeopathic medicine for tendency towards recurrent/habitual abortion at 5 months. Kali Carb is one of the most prominent homeopathic medicines for tendency towards recurrent habitual abortion at 5 months. The symptoms narrated by women during such abortions include bleeding with back pain radiating down the hips and thighs. Kali Carb will also show great results in treating weakness arising from the miscarriage. Sepia succius. One of the most reliable homeopathic medicines for tendency towards recurrent/habitual abortion arising in the 6th or 7th month. Sepia succius is a well-indicated homeopathic medicine for treating the tendency towards repeated abortion occurring at 6 or 7 months. Abortion in the 6th or 7th month with bearing down pain in the uterus is a prominent symptom that decides on Sepia succius as the best medicine. In a few cases, griping or burning pain in the uterus may be observed. Case study will reveal irregular menses, yellow-green leukorrhea and uterine fibroids. Ferrum metallicum. Homeopathic medicine for tendency towards recurrent habitual abortion at the end of 8th month. Ferrum Met is very useful among homeopathic medicines for tendency towards recurrent habitual abortion occurring at the end of the 8th month. Women who need Ferrum Met will have a history of previous abortions with pale blood and shooting or labor-like pain in the uterus. Profound weakness and anemia may also be observed among women who need Ferrum metallicum. Ferrum Met and Trillium pendulum. Top homeopathic medicines for tendency towards recurrent/habitual abortion in anemic women. Anemic women having a tendency towards repeated abortion will benefit greatly from homeopathic medicines Ferrum Met and Trillium pendulum. Ferrum Met is useful where women have had many miscarriages with pale and watery bleeding. This is attended with labor-like pains in abdomen and small of the back. Trillium pendulum is the most effective among homeopathic medicines for tendency towards recurrent/habitual abortion in anemic women who have had early miscarriages with gushing bright blood. The bleeding worsens with the slightest movement. The bleeding is attended with pain in the hips and back. Arnica montana, Erigeron, Crocus sativus, Sabina officinalis. Significant homeopathic medicines for treating threatened abortio. Arnica montana is one of the well-indicated homeopathic medicines for treating threatened abortion from trauma, falls or injuries. Erigeron is considered when there is threatened abortion from exertion. Crocus sativus will best treat threatened abortion with dark and stringy blood. Sabina officinalis shows best results in case of threatened abortion with marked pain from sacrum to pubes.